Welcome to our broadcast. I'm your host, Melissa Tizon, VP of National Communication for Providence. As a reminder, the information provided during this event is for information purposes only. For any medical questions, please reach out to your primary care or healthcare professional. Now, let's begin. I'm super excited for this conversation today. I'm here with Sara Vaezy, our new Chief Digital Officer for Providence, and we're prepared to geek out on health tech and innovation. So why don't we just jump right in? And Sara, I know you've been at Providence for 6 years, but I would love to just kind of hear your journey about how you got to Providence and how you got to the role that you're in today.
Sure, absolutely, Melissa. And usually on these broadcasts that we do, I'm on the other side of these things. So thanks for asking the questions today. As you mentioned, I've been with Providence for 6 years. The whole time I've been within the digital innovation group. And prior to coming here, I've spent most of my career in healthcare and adjacent to healthcare. So it's a little bit different from many of the other really talented folks that we have in DIG that come from DIG, meaning Digital Innovation Group, that come from technology. But I've spent my career in healthcare. I was with a management consulting firm that worked with providers. And I did a lot of work in population health strategy. I built a couple of population health companies with large IDNs throughout the country. Did a lot of work in enterprise strategy. So kind of at that macro level, just what are the big forces and things that health systems need to take into account in order to continue to serve our communities. I think we're a vital part of delivering care, and that's where most of the care in the country is delivered, is within the context of physicians, practices, and health systems. So I spent 6 years doing that kind of work. And then before that, I was actually at the intersection of sort of health services research and health policy. I worked with some of the state agencies in Washington State where I was living, with the State Healthcare Authority and with the Office of Financial Management, doing a variety of policy related and program related things. I helped with some of the very early state sponsored medical home stuff with the Department of Health and the Healthcare Authority. So it's been a journey in healthcare. And then before that, I was a research scientist. So my background is actually in the hard sciences, and I worked as a researcher at a medical device company doing work on therapeutic ultrasound that was being used to deliver clot-busting drugs to people who are suffering from strokes and from peripheral arterial disease and things like that. So again, like kind of translational research, health policy, consulting in the provider side of things, and then finally in this more operator role within the context of the system.
Yeah, that's so cool. I forgot that you have a background as a scientific researcher, and I'm sure that brings a lot to the table to what you're doing today. So one thing I wanted to ask you about is, so Providence is based in Seattle, which is also home to a lot of innovative companies like Amazon and Microsoft, and your predecessor, Aaron Martin, came from Amazon. So when we built this program 6 years ago, really focusing on innovation, it was really like a new thing to like bring people from outside of healthcare in to do innovation. And I was just wondering if you could comment on, how much progress have we made in the last 6 years? And is this still a novel idea of bringing innovation to healthcare delivery? Or is everybody doing it now?
Well, a little bit of both, actually. So I came here 6 years ago. Aaron had started the Digital Innovation Group 8 years ago, so just a couple years before I had joined. And I think he was the first chief digital officer in healthcare, which was truly groundbreaking at the time, right? Nothing like it existed. But over the years, as we've evolved our model, I think we continue to be innovative. And there are a lot of really great health systems doing super interesting and innovative things like building technology, doing venture investment, like really focusing on like outside in innovation, and doing inside out innovation. So they really like think about how they bring up their own system in terms of doing its own innovation and then bringing it to scale. But often those types of things kind of exist in pieces. And I think one of the special things about our model is that we've brought the pieces together in terms of focusing our digital efforts and focusing them, it's not just digital actually, focusing them on a really specific kind of use case around being a vehicle for growth for the system. So our system, when we talk about digital innovation, it's actually a combination of marketing, which is marketing for any service that our health system provides, whether it be physical or digital, as well as digital experience, which is all of the stuff that we do on our website. So it's really the whole awareness, conversion, e-commerce side of our business. Working really closely with our region. So we do a lot of that, all that consumer facing stuff. And then we have a digital product development organization that builds technology. And these two work really closely together. So we combine these efforts to become a vehicle for growth for the system. And I think that continues to be really unique. Another area where we focused that is very unique to Providence is that we have a track record of spinning out consumer-facing companies that are that go to market. So they're not part of the digital innovation group. After a while, we have an innovation model that we've operationalized around how to make this work and do innovation sustainably, so that we've got a very long list of problems that we're tackling one by one, and our model is to tackle those problems kind of very systematically, do build buy analyses, and when we choose to build, then take them to market and make them available to other health systems so that we can kind of spread the love and spread the benefit and impact of these technologies to others. So that systematic approach to commercialization and to incubation and innovation is unique to Providence and to what we've done as well. So we're going to continue to do that, and it's going to be a big focus on an ongoing basis.
Yeah, I mean, you were talking about how your team is building products. What are some of the things that you guys are working on? And can you talk a little bit about the team itself? Because I don't know how many health systems, like have innovation groups like the ones that we have, where we have engineers who are actually helping us build solutions that we need.
Yeah. So the team is comprised of about 100 folks. You referenced engineers, the team that builds technology, and we actually have building capabilities in other places, like within our digital experience group, and as well. So we've got this kind of deep DNA for building and data science and building experiences and things like that. But on the product development side of the house, we're building things that are very core to essentially think of this notion of consumer and patient engagement. That's a big buzzword these days, like engagement. Everyone's trying to do engagement, but we've got a pretty specific point of view on how you can do that, and we've built some specific technology to support it. One is an identity platform. So digital identity, and like I'm one individual that the system recognizes, and I can, for instance, log into any property, any digital property of Providence with my one login, right? That's actually tremendous. And instead of forcing people to have these fragmented experiences, different logins that are hard to remember, and you got to do password resets, and you got to do all this other stuff, instead we have one identity, and that one identity assigns to one person. And that's been a core part of what we've built. And we went live with it across our entire system last year. It may not sound very it's not a lot of flash or it's not a lot of sizzle. It's very much steak, but it is super foundational in terms of enabling those unified experiences, reducing the fragmentation around the data on the back end so it can be assigned to a specific individual. And then it can guide things like personalization. And that's where it starts to get to the next thing we're building. We are also building something called our consumer engagement platform. The consumer engagement platform is essentially like the single access point for all your stuff, right? You may be trying to book an appointment. You may be a user of things like OMADA, which is a diabetes prevention program that's digitized. You might be getting you might be having a baby and want to use Wildflower Health. All of these different things need a single access point, or again, you're fragmenting the experience or you're making it really difficult for consumers. So, how to book an appointment through with our Express Cares, powered by a company called DexCare, all of that stuff kind of shows up in there. And it is, that's another big thing that we're building. And then over time, we can also build stuff like around personalization engines that create unique to you as an individual content that gets recommended to you, services that get recommended to you that are all clinically appropriate, help you stay healthy, help you get access to care when you need it. And so those are some of the things that we're building today.
Yeah, I mean, I know you were saying that it may not be as exciting, but these are the things that people take for granted. Like they expect it in every other aspect of their lives, like
totally
these types of things. And why has it taken so long for healthcare to start implementing this?
Well, I think I always think about there's like sort of and this is a hyper simplification. So, take it for what it's worth, but there's actually, it's a triad. There's the business model. So how does stuff get paid for? There's the operations and how does it actually get done? And then there's the technology enablers. And we have challenges on all of those things. Fee for service models and like traditional business model in healthcare isn't that supportive of this kind of stuff, right? Like it's not, it only has, it doesn't really support keeping people healthy. It doesn't really support getting other products and services that would, for instance, keep them out of the hospital. Like the business model is kind of broken, right? So fee for service and the whole business model component, that's one challenge. The other challenge is like operationally, health systems are extremely complex and they fundamentally operate based on that business model. So again, there's like a tremendous amount of interdependency there, and that can slow us down, and that can be difficult to manage through. Now we've got like extremely talented operating partners, and what I would say is that in the past, when we've had success with innovation, it's been when we've been able to partner really closely with operators and clinicians throughout our system. So it's an absolutely essential element, and we have some points of success that we can point to around that, which is awesome. The last area is around the technology. It's pretty outdated. So, I think a lot of folks know healthcare still uses faxing as a very key way of transmitting information. That is like as old school as it gets. And so we've got some really foundational technology infrastructure like modernization that's required. And I know, like, for instance, our IS partners at Providence have been working on a lot of this modernization, which is going to be a key enabler of making progress over time.
Yeah, I'm so glad that you brought that up, because the death of the fax machine in healthcare is like, I can't wait for that day that we can just say, we're not using fax machines anymore. It's so old school, but yeah, I think it really speaks to how far behind the technology has been.
Yep.
So one of the things that I wanted to bring up is, so many tech companies, big tech and new entrants have been trying to get into the healthcare delivery space. So like we've had, Google Health is now defunct. Amazon has like been in and out, so we have so many different tech companies who are coming in, and, our CEO, Rod Hochman, he wrote an op-ed that I think really struck a chord last year. And it was, about why big tech hasn't been able to get it right yet. And I know like a lot of that has to do with, from his point of view, it really is the human connection. Like you can't replace like that physician caregiver patient relationship. So I think that's kind of like what he was getting at, is that health tech or tech companies need to be able to zero in on that. So I just was wondering, Just if you could comment on your perspective from what he wrote in that op-ed.
Yeah, completely. And, Rod has also, like, since I started, he had this like framework that he would always put in front of us, which is if you have tech people and you have healthcare people in the middle, like that intersection on the Venn diagram, that's where the magic happens. And it happens that way for some of the reasons we just talked about, right? Like a technology person from the outside would have a lot of difficulty understanding like how hard it is to operationalize technology within the context of a health system and how much burden there is already on caregivers and frontline folks that are the ones that are ultimately kind of responsible for all this stuff. And so you really need that perspective. And otherwise, what happens is technology just gets layered on and it just adds more burden and it's not transformative, right? It's just additive, and that adds just more difficulty. One thing I will say, you brought up Google, you brought up Amazon doing all the different things that they do, Apple, there's Microsoft had done things in the past as well, and they're of course a key partner of ours. But I would say one thing that I always caution folks against is that while they are maybe coming in and out of healthcare, they are determined, right? And they're well capitalized. They have a tremendous ability to learn and to figure out ways to get the information that they need in order to be impactful. That's what these companies are. They're innovation companies, right? And so we need to make sure that we don't think that they're just giving up, right? They may just pivot their strategies. They may figure out other ways that present them with better opportunities and better business models. And so I think that's what we as health systems just need to understand, that and position ourselves to be good partners and to engage in that conversation, as opposed to just being like, oh, they're not going to be successful. Like, who cares, right?
Oh, I think that's a excellent caveat because it is about partnership, because we'll never figure this out on our own, that we really do need to partner with folks who understand technology. And I think one example of that is one of my favorite stories is about Mike McSherry and the Entrepreneurs in Residence program. And can you talk a little bit about how that worked, how you were able to bring someone in from the outside to kind of shadow the challenges that our clinicians faced and to help find solutions for that?
Yeah, totally. And like Mike and the Zell story, it's like one of my favorites, and they're so awesome. They're wonderful people, and they did like tremendous work. All we did was give them the conditions to go out there and and do the problem solving and that they needed to do and be successful, and provide them with guidance occasionally. So the way that program worked was Mike and his team of entrepreneurs that he had worked with previously, they came in and they just went out and talked with clinicians and with operators and asked them, what are your key pain points? And they really just like dug into the problem until they came up with the hypothesis that like we've got all sorts of digital as well as offline services that we just can't easily get in the hands of our patients, or a provider can't get easily in the hands of our patients in the context of a visit, right? Like they have to print something out and then the person has to be on the hook for going and finding it themselves and all this stuff. And so in the clinician workflow, they put this digital prescription button that anybody can go and they can then get a MyChart message that then prompts them to go and do these things that they need to do. And it could be something like go download an app, or it could be we're prescribing you a meal kit or a post-discharge recovery bundle, like, a recovery kit or whatever. It provides that connectivity and the feedback loop, so if the patient actually did the thing that the provider had asked them to do, and so on. That's a very deep problem that unless you get into the guts of the system and talk with the people that are dealing with this kind of thing every day, you're not going to be able to come up with that. So that model, just Mike and his team, and of course they're very talented, not everybody is like them, but they were able to get into the guts and really understand that and partner with all the right folks with digital, with IS, with clinicians, with patients to understand their needs and then develop this. We haven't actually done an EIR program since Zelf, and so we're excited about resuming this kind of approach to outside innovation with founders who have the ability to problem solve in a unique way that with like some distance and just a different skill set than the folks that are internal all the time, you know. And we haven't done it because we've been really focused on our own product development efforts around a couple of really like specific areas like identity and navigation and engagement, as I mentioned. So so this will just be a great way to broaden the aperture and bring even more outside in innovation into the system.
Yeah. I mean, I think it just speaks to Providence's openness to have, you know, to partnering with those on the outside, and we don't assume that we know all the solutions.
Totally.
So we have some questions that we need to get to from the audience. So the first one is back to your comments earlier about personalization. So how are you capturing voice of the patient consumer or using this feedback to fuel the personalization process?
So a number of different ways, and I'll just highlight a couple of them. So we do a tremendous amount of user research and design work throughout the product development process, as well as throughout the process of all the work that our digital experience team, for instance, does to understand like what do folks care about? What are they trying to engage in? What matters to them? And then incorporate that. So that's one big body of work, is just like listening to our consumers, testing things with them, and iterating based on what we learn. Another big thing, which I think is often, one, it's a little bit more difficult to do, and two, it's often or less often discussed, is just that because we are digital, right, in many ways, we have the ability to instrument our digital journeys to be able to measure and understand behavior across them, right? So nothing quite does it the same as like when you actually witness how folks are making their way through a journey. Where might they be dropping off because there's friction that we're introducing? And so we do a lot of instrumentation and data collection and analysis to really understand, like, there are certain forms of data that don't lie, and behavior is one of them. And so, you know, it's the combination of like the user research and the insights that we get there, plus the understanding that we gain from the instrumented platforms and the analysis that we do on them.
Yeah, and how people really behave.
Exactly.
So I think that the next question is really similar to that. You may have covered some of the response, but it's, do you think that consumer, patient, and provider engagement have any major gaps? If so, where do you think is the next frontier for merging experience and access on a seamless communication platform?
So this is a topic of that I think it spans beyond digital, but it certainly manifests itself very specifically in the digital realm too, which is around health equity. There's also a concept of digital health equity, right? Or digital equity. A lot of the technology that we've built is kind of geared toward folks who are already tech enabled, right? Like they have smartphones or they know how to make their way through various digital properties. And so there are groups of folks that we naturally miss in that, you know, if we come at it with the traditional sort of like Amazon, e-commerce, you know, super digitally savvy kind of mentality. And so I think equity in general is a huge next frontier. And we're making some progress in that arena, but and I would say like we're making it in more like how we think about language, for instance, and being multilingual and culturally appropriate, right? Like we're just starting to scratch the surface on some of this stuff, but then how you actually design and build products for other customer segments is something that we're still very, very early in our journey. And I think that, you know, there's some great companies out there that are doing this work that we can certainly partner with over time, but even they are relatively earlier in their journeys too, right? Like there's a tremendous amount that we need to do to close what's called the digital divide. And I would also say it's just a really difficult, it's a difficult domain it's easier said than done, in that there are some serious structural barriers to like availability to data and all sorts of other things that just make it a tough problem to solve. Now, there are some very, very interesting companies out there that like are even making things like data more available through unique business models. So I think we're going to see a tremendous amount of innovation in this space, and I'm very excited about it. But it's, you know, something that it's just really early.
Yeah, that's just a fascinating point about the digital divide. And I know that one of the other companies that we work really closely with and helped founded True Beta is, you know, really trying to build up data on all population segments so that we have a good picture of, you know, how disease affects certain groups more than others. So yeah, so that's one of the things that you were alluding to related to data. So I know we have another question here, but before we run out of time, I do want to ask you about COVID and how did your group, what was your role in the COVID response for the overall healthcare delivery system? And what was that experience like for you?
It was obviously a really difficult time, but you know, we jumped in to help where we could. So for instance, our digital experience team built a consumer hub for COVID. It had all the information that we needed, that our patients needed, and we're looking for like trusted guidance about what to do, where to go, you know, where to access additional resources. Our marketing team leaned in very heavily on just, again, like awareness and bringing together a consortium around COVID. In the early days, our product development team built a screening and triaging chatbot that said, okay, like based on your symptoms, do you think you should, can we escalate you to a provider? And if that provider, then we built a virtual visit platform that actually did orders of magnitude scaled up visits over just a couple of days. It actually provided patients access to health system providers so that they could get additional levels of care and then get tested or hooked up with home monitoring if they needed to. So then we also partnered with another company to stand up a COVID monitoring program where folks could, if they tested positive, they could remain at home and submit their data a few times a day so that we could ensure that they were stable rather than, you know, kind of getting worse and needing to come in. And so all of these different things were done in very rapid fashion and with partnership with our operators and clinicians across the organization. And it was a very, I mean, it was a difficult time. It's been a difficult time for everybody, but it was truly remarkable to see the speed and the partnership that we were able to have with folks to get stuff done in just a time of crisis so that we could serve our communities efficiently.
Yeah, it was amazing. It was such a key part of our response. So would you mind if we do like a lightning round of
sure.
questions that are coming in on the chat, and then we can wrap up? So what are the top 3 to 5 problems you're focused on addressing at this time at Providence?
I'll just summarize it really quickly, which is to say, growth. We have to grow. We have to be able to access new patients across our communities. And then we have to be able to continue to serve them and retain them, and do so in a responsible way. And that's essential for our recovery and renewal efforts across the system as well. And so I think the name of the game is growth in service to the community.
Yeah. And, you know, one of the things that we saw with COVID is that there was so much care that got deferred because we didn't either have enough staff or enough PPE, or because people were staying home because they didn't want to potentially get infected. So we have all this deferred care out there, and that's what we need to go back and make sure that we're getting back to everybody, making sure that they get the care that they need. And you know, it's been challenging because we are in such a staffing crisis right now. So the work that you're doing to help us reach those patients is really critical. So this is from a company called Echo, and they're saying, how can health tech companies like us and others can be more supportive and an engaged partner with Providence, specifically with your team, Sara?
Well, the first thing I would say is that any company out there, get in and talk to folks, talk to operators, talk to folks who are within health systems and really understand our problems. Like, I think that's the key, right? Understanding the problem is the first sort of hurdle that any company that wants to partner with us should be able to jump over, because if it's a big enough problem for us, we'll move mountains to be able to solve it with you, right? But if it's not, then we have so many things, so many priorities, so many like really tremendous problems that are on our plates right now. So I think that's number one, and then we can figure this out from there.
Yeah. Okay, last question, and it has to do with AI. Has Providence ever thought AI could help solve workflows throughout the hospital?
There are a lot of different examples of this. I can give you one example of where we're doing some work with respect to AI and clinical workflow and clinical messaging. So one of the things that happened during COVID, because a lot of folks became digitally enabled throughout this process, right? They'd never used telehealth, or they hadn't maybe sent messages to and from their provider digitally, but now they have, right? Because we were trying to keep folks at home and keep them safe. What ended up happening is that we generated tons of messages that our providers had to sift through. So their inboxes, their inbaskets became overwhelmed. And it is an unintended consequence of something that we were really, it's important to get folks online, but then it created this other challenge on the back end. So there are lots of technologies out there that are actually focused on taking those messages, triaging them, finding out the appropriate way to deal with them, and taking them off the plate and using AI actually of the provider. That's one use case. Another use case is to say, why are folks sending messages in the first place? And often they're sending messages in the first place because they either don't have the information, the content, or the tools that they need to at their disposal kind of earlier in their journey, right? And so imagine a situation in which AI and machine learning can understand those messages and then present the appropriate content, present the appropriate tools to individuals so that they can solve their problems themselves.
Yeah, well, thank you, Sara. This was a super fun conversation, and we're really excited to have you in this new role. So I also just want to thank everybody for listening and tuning in and sending in your questions. To learn more about what we've talked about and other initiatives, programs, and services, or ways to give, or if you're looking for medical care, please visit providence.org. And be sure to follow us on social media at Providence Health System for LinkedIn, Facebook, and Instagram. And also you'll find us under Providence on Twitter. So thank you so much, everyone.
Thank you.